All right. Today we have been joined by the Bon Secours St. Francis. Is how they're easing visitor restrictions, allowing one visitor per patient per day between 10 and 6. This is to support people who will be allowed for women. Two will be supported for women in labor. Join us now to talk more about this is Dr. Steve Newman. Thanks so much for joining us. You're a primary care provider with Bon Secours. And for more people who are returning to work and people are getting out to restaurants and doing more shopping as we get back to normal, what recommendations do you have for adults and children who are leaving their homes and going out in public?
That's a great question, Cody. As society begins to reopen and transition back to pre-COVID normal activities, it's imperative that we remember that we're still living under the shadow of a global pandemic. And although we all want to return to normal as quickly as possible, we must not let our guard down. A continued emphasis on social distancing and proper infection disease precautions is absolutely necessary in order to limit the potential for a surge later this summer or this fall of infected individuals and therefore, COVID-related deaths. Mask wearing in public spaces as well as frequent hand washing is critical. Avoidance of close personal contact and staying home if you feel sick or have a fever is also still incredibly important. Even though we've kind of come through a period of time where we feel a little more comfortable and confident, we need to be careful about becoming a little overconfident in our return to normal.
And Dr. Newman, a lot of folks, we have seen reports and heard from different offices, doctor offices, that people are not keeping up with their regular checkups. They're ignoring maybe some signs that their overall health is maybe in trouble because they're scared to go to the doctor's office because they're scared of possibly getting COVID-19. What do you tell folks who have ignored their own health because of the fear of COVID-19?
Yeah, Cody, that we're seeing a lot of that. You're exactly right. And I believe that that's clearly a natural response. It's estimated that about 50% of Americans have delayed or postponed medical care during the understandable concerns regarding the COVID-19 pandemic. However, it's incredibly important that individuals who need to see their physician or primary care provider not delay nor avoid being seen for fear of COVID-19 exposure. Physician offices are vigorously screening patients prior to allowing entry into the practices. Temperatures are being checked, mask wearing is being required by both staff and by patients, and rooms between patients are being meticulously cleaned and disinfected. So the likelihood of an unintentional exposure is really extremely low. Chronic medical care and acute care has got to continue, and I strongly encourage individuals not to delay that.
And Dr. Newman, telehealth was not new. It's not a new thing. It just seems like it's gotten more attention since COVID-19. Do you think, though, telehealth and these virtual doctor visits are going to be the new thing people are going to, or do you think still going to see your doctor, that one-on-one interaction is still going to be an important part of healthcare moving forward?
Yeah, Cody, virtual visits have proven to be incredibly valuable during the months of societal shutdown related to COVID-19. The virtual visit platform allowed us as physicians and providers a safe venue to provide patient care in a time when people were scared, and understandably in a time when we needed to socially isolate. I definitely believe that virtual visits are going to continue to serve as a vital component in that continuum moving forward. I don't think personally it's to replace the care of the individual, but more to augment it and to support it. The safety and convenience of virtual visits is clearly evident, but it's also wise to recognize that not all patient care encounters can be safely done via a virtual platform. But is it going to continue, Cody? Absolutely, yes.
And Dr. Newman, what about chronic conditions, heart disease, diabetes? We hear from different organizations who they say they're kind of concerned because some of those reports say those chronic diseases have been down, some of the reports, but it also goes back to what we were talking about a few minutes ago, that maybe some folks just are not going to get the help they need from doctors, and some of those chronic conditions are not being treated or diagnosed, again, because of the fear of getting maybe COVID-19 here during this pandemic.
Yeah, just because we've gone through a pandemic does not mean that suddenly, a person with diabetes or heart disease or chronic kidney disease no longer has those medical issues or conditions. So there may be a noted decrease in visits related to those conditions, but they are still there, obviously. And the longer a person delays being evaluated and treated for their chronic medical issue, the more chance there is that that condition is going to deteriorate. So it is vitally important that individuals continue to go to their physician and be evaluated for these chronic medical issues.
All right, Dr. Newman, thanks so much for joining us today. We really appreciate it. And always
Absolutely.
don't forget, if you
Want to watch this interview again, you can go to our YouTube channel. Just find the link at foxcarolina.com.